Welcome back to Mama Needs a Moment, and another very warm welcome to our Her Plus expert providers who are joining us for our discussion today on mom metabolism and what changes, what doesn't, and what you can do about it. Together, we are all striving to help moms understand what is actually within their control regarding their metabolism, what's normal, and what sustainable habits truly support long term health and vitality. Before we begin, each expert will briefly introduce themselves and share their area of focus. This way, our listeners will be able to tell through the voice who is talking. And then I just wanted to make sure I mentioned that our podcast episodes are also available in video format on our YouTube channel. So if you'd like to see all of our experts and the energy we give as we're talking to each other, that's another option for everyone that's listening.
Hey, everybody. My name is Kate Lehman, and I am a certified nurse midwife. I have been working here in the Triangle since 2009 in a variety of areas, home birth, birth center, and attending births in hospitals. And I recently started a practice called Mother Love Wellness after having observed some of the gaps in women's healthcare. I'm focusing on early pregnancy, less than 10 weeks gestation, the first postpartum year, and the perimenopause.
I'm Abby DeVries. I'm a family physician and certified menopause practitioner. And I also recently opened my own practice. It's called Sabia Health. It's a direct primary care practice focused on women in midlife, located in Durham, but I can see anyone in North Carolina virtually. And so I'm actively recruiting for patients who are just looking for kind of full scope primary care or just need some help getting through menopause and perimenopause.
I'm Catherine Andrew, and I'm a registered dietitian. I have been in practice for about 20 years and have a practice that works primarily with women. And we do comprehensive nutrition, whole body support, where we focus on digestive health, hormone health, and metabolic health, and really love to support the nervous system above all else as it relates to nutrition and health in that way. I have recently, in the last few years, delved more into focusing specifically on women in perimenopause. So I work with women in that age group and love my work and love helping women navigate so much of the clutter that we see online.
Hi, everyone. I'm Sarah Parise, founder of Great Days by Sarah. I'm an ACE certified personal trainer going into my 21st year, which is crazy. So yes, I started when I was like 8 years old. And then I tacked on a perinatal wellness specialty when I found out I was pregnant. So I work with moms that are going through pregnancy or trying to get pregnant, and then through their whole journey of becoming moms, where we tend to fall to the bottom of the priority list. And I learned that the hard way as a mom. So now I work with moms in the physical, the mental, and emotional capacity of carving out 2% of the day for themselves so they can love the way they look and feel, have more energy and confidence.
I want to give a trigger warning for our upcoming episode. We will be talking about dieting. So if you are sensitive, you've experienced eating disorders or disordered eating, I just wanted to give you a heads up to take care of yourself if you are going to be listening to this episode. So many women are told that if they're struggling with fluctuations in weight, energy, or blood sugar, they just need to try harder. That's basically what the wellness industry tells everybody, is that it's you're the problem, at fault with whatever you're trying. With dieting and making healthy changes in their life, it's just that constant parroting of it's my fault, it's my fault. But that message often makes things a lot worse. Why does repeated dieting tend to backfire for women, especially moms? How does it increase fatigue, stress, weight cycling, and metabolic resistance instead of improving health? And why is the wellness culture messaging so extremely harmful?
I think the biggest reason it fails is because it's not sustainable. It's not how we can live. And so I work in that space, and what many of the moms that come to me say, I want to lose the baby weight. That's like the number one complaint that I get. And when it really comes down to it, it's like we've lost ourselves. We've lost our sense of self and how we used to feel before we became a mom. And yeah, the weight, obviously, it's a very measurable number on a scale. But to take that diet and like restrict everything and restrict the calories and restrict the foods you eat, you can't sustain that throughout life. So I always say like consistency is better than these all or nothing or like forever or always kind of rules of things. And the most important part is to do those small steps that do stick and not to completely deprive yourself of it, because then when you come off that diet or come off that now shot and you haven't changed anything else, not only does it all come back on, but it's actually worse to yo-yo than to maintain a higher weight. So the culture is my biggest barrier of convincing moms it's not about the number on the scale, but it's how you feel in your clothes, and it's the energy you have and the confidence you have. And unfortunately, in our culture, a lot of the times it is tied to that scale. But the dieting just makes it even worse. And those hormones fluctuate and change, and you can't maintain. So it's like that consistency beats intensity every single time.
Do I have like an hour to answer this question or just 15 minutes?
I know. It's so hard to just squish it down, right?
It is, but I echo everything Sarah just said for sure. And I would say another big thing is that we are so hyper focused on restriction and minimalism. And the conversation is always, when you think about nutrition, the immediate thought is, what am I eating too much of and what do I need to remove? And it is harmful. And it is, we are working with women. I'm 45 myself, and I've been hearing that message for 45 years. And so there has been this chronic underfueling for women who are in perimenopause right now. And it is hard to let that message go, that the answer must be that I am eating too much, that I am intaking too much, and I am not moving enough. And so I really feel like we are starting to see a little bit of shift of working towards like building muscle, right? This idea of like the first thing in many years that has been more of sort of an abundance mindset. But if I go way back to when I talked about metabolism as this idea that your body's not going to rev up metabolism if it does not feel safe. And if you are chronically stressed and doing a lot, which we're all doing, and you're under fueling, then we're just not going to see much change in a healthy way for women when it relates to metabolism. So I would say the focus on restriction rather than abundance, and figuring out what can I get enough of? Am I eating enough to stabilize my blood sugar, rather than what do I need to avoid, is one of my big things for sure.
To go back to the yo-yo dieting, I'm worried we're going to see more of this with the GLP-1s and people having access and then not having access, and losing a bunch of weight and losing muscle because they're not appropriately fueling and strength training. Then when they gain the weight back, the fat kind of comes on more quickly. And then there's also something about the set point too, that and it's probably around the safety issue of like, if you're metabolism is worried that there's going to be a time when you're forced to kind of lose all that weight, it's going to make it harder to lose that weight. So definitely the yo-yo dieting, and there's probably some cardiac, problems with that as well. But just the pure like being able to lose the weight again in the future is harder. And I think there's some studies that show that the emphasis, and I've had to have the same frame shift because I'm older than you, Catherine. So I've been hearing these messages longer, and like the, Kate Moss models of the 90s. Yeah. Now what I try to do is I try to keep as my model of like what I want to be as someone who's got muscles. And I notice that more now, that like what I seek and what I think seems healthy is not someone who's way thin, but who has muscles. And that's what I'm trying to build, not just for my future, but also for like, vanity's sake, but for the future specifically. And I think that if we keep talking about this message, I think it's going to lead to hopefully healthier attitudes and people feeling healthier too. So the appropriate fueling and the strength training, I think is very important. And then certainly there are people that have an unhealthy amount of weight, and we need to help them to do that as well. And hopefully they're doing that under guidance. But the shift away from diet culture would be, I think, very welcome.
Yeah, I'm fully agreeing with Dr. Abby about all of that. I have the same thoughts and fears about the GLP-1s in the future, as a woman who's myself, trying to navigate this perimenopause, but also helping other women keep their bone strength and prevent muscle loss. I personally know people that are on GLP-1s, and when I ask them about, okay, you're losing weight, but how do you know you're not losing lean muscle? How do you know what you're losing is fat? They are just not getting the oversight that they should be. But I fear that with this increase in, all of the GLP-1 women are not getting the oversight that they need, and they're not getting the wraparound services of nutrition and strength training, that is going to impact their bone health, in the future. And I'm shifting my vocabulary to my daughters, and I have 2 nieces that are elite athletes in college, that I'm talking to them about REDS, which is energy restriction now that can possibly affect their reproductive years and their bone health in the future. So I think just we're all becoming more aware, and hopefully shifting the narrative and the conversation around becoming strong as women, not thin.
Right.
Yeah.
One shift that I have seen is I work with women that are on those shots and in that journey. And the last two that signed up to work with me for my program, their doctor said, we will not prescribe this unless you're working with someone on the strength training aspect, because it is proven that you lose more muscle quickly.
Yeah.
Like that's just where it pulls from first. So I love that. And I'm loving the journey that they're on of really changing their lifestyles. So not just like doing the shot and losing the weight quickly. They're doing it a little more slowly, and incorporating the strength training and the meal prepping and just I'll say nutritional awareness of it. Because it's not, like Catherine said, not about restricting, but more about like, am I getting enough protein? Am I getting enough fiber? Am I getting the vitamins and minerals that I really need to sustain this in the long run? Because it is appropriate for some people. Like people ask me all the time, are you anti-shot? And I'm like, no, I think there's a time and a place, and there has to be other structures in place as well. It can't be the only thing you're doing.
So well said. I agree, Sarah, in that I'm not anti-GLPs at all. I think they're fabulous tools at times. I wish it was more of an only when type condition. So the physician I work with is, again, you have to be checking that box that I am working towards hypertrophy and working with a trainer. I'm working with a nutritionist to make sure that I am not losing muscle, and we're measuring that regularly, because otherwise I don't think that as a medication they are going to provide long-term health, which might go back to the question in terms of what often fails is that we are so focused on the short term when it comes to diets, rather than thinking and just acknowledging, embracing that this is going to be a process, and it is probably better when done slowly and patiently for our whole body health than something that provides quick results. I mean, what's new about our culture? But I think that's where really helping women, no matter what tool they're using or how they're going about it, do it almost as slowly as possible so that it is more about the habits and the systems that they're developing rather than the immediate outcomes that they're looking for.
The doctor I spoke to compared it to being on anti-anxiety medicine and not having a therapist. Like they're like, it needs to be a team of people that are working towards this in so many aspects of our health.
That's a great analogy. Yeah.
One for sure.
My question with the shots and GLP-1 isn't that feeding diet culture, or is there actually need for it? Can you help me understand, and perhaps listeners?
One thing I was going to mention, there's an endocrinologist, Rocio Salas Whalen, who just wrote a book called Weightless. I haven't read it yet. I think it literally just came out. She's been on several podcasts. And a couple of things that she said that I think are really fascinating. So one is around what you were just talking about with not losing weight too fast. And so you want to have people actually have hunger signals that they learn how to respond to in a different way. But if you have them on the highest dose, depending on the patient, and it's eliminating all sense of hunger, they're not learning to do things differently. So I think that's important. The other thing is, I mean, to answer your question, Cindy, these drugs have a huge role in kind of helping us reverse generational obesity. And she talks a little bit about this, that there's actually some epigenetics at play where we're almost passing obesity down to future generations. And if we can interrupt that and have people learn how to healthfully eat and maintain a healthy weight through their reproductive years, that they will pass on a healthier state of being for their children, which I thought was fascinating. So I do think there's a role. And I think that while we do have people who are underfueled and underweight, there's also an undeniable obesity epidemic that's leading to diabetes and heart disease and other diseases of the metabolic syndrome that are causing premature death in our country. And a lot of it is at the foot of the food industry, which I won't go into. In my opinion, I think there is a huge role for them. And I think they're safer and more effective than some of the other medications that we use, although I use those some too when people can't get coverage. But they need to be used sort of, under guidance, is my opinion.
And these drugs aren't new. I think they're newer to like the general public, but these, like the GLP-1s have been around. I mean, I think they were approved in the early 2000s, working with men and women who were struggling with type 2 diabetes and taking the weight off to have that be like the first step. So it's not like they've been around a long time and they've had success in the society that we live in. But to your point, Cindy, like, is it kind of driving more of a diet culture? Like, I don't diet, now I take a shot instead, kind of thing. It's kind of a tricky middle. Like I said, I think there's a time and a place, but it should not be for the woman that lives down the street from me that needs to lose 15 pounds and got prescribed the shot. Like, that to me is like, that's a road that I don't want to go down in our society. But the generational trauma of obesity and turning it into that generational wellness, I think, is a huge piece of it.
Dr. Abby, I've heard that they've started to look more at the GLP-1s for people that are in perimenopause because it might be helpful for certain things that they're experiencing. Can you share any feedback that you have in this area?
Yeah, I mean, I think it's still so new. I mean, we have so little research on perimenopause in general, and the use of GLP-1s in this way is new. But they're anecdotally, the hormones and the GLP-1s tend to play well together for people who are struggling with insulin resistance specifically. And again, if you're doing that with strength training, appropriate diet, but I mean, I see a lot of prediabetes in people that you would look at and say, well, they look pretty healthy. And being able to jump on it now with something that's very effective that will help them to stay healthy and stave off cardiovascular disease in their 60s and 70s. I think there's a lot of promise for that.
Yeah, I'll also add that the anti-inflammatory effects of GLP-1 seem to be, very beneficial to women in the perimenopause. And part of that is the inflammation cascade that comes with a different distribution of fat that we get. The more visceral fat, it's a larger fat molecule that tends to stimulate inflammation in the body. And the GLP-1s, maybe not in the same dosage, but more of a micro dosage, seem to be also helpful for just that inflammatory cascade that women experience in the perimenopause.
Yeah, and then they can get to Sarah and start exercising, but sometimes they're in so much pain and are carrying, some excess weight that they're not able to do the things that we know physically are beneficial for them.
Thank you so much. That was all very, very helpful. If dieting isn't the answer, moms are often left wondering, okay, then what is actually in my control? And I think throughout our episodes, we've touched a bit on this, but let's sum it up for everybody in one nice little package. As women age, particularly through perimenopause and menopause, what truly matters most for metabolic health, body composition, and long-term well-being? And what can moms safely stop worrying about when it comes to weight, insulin resistance, muscle, and bone health?